And basically, basic critical care echo is gonna mean very clearly that you adapt your eye to use your eyeballing to assess in a matter of few seconds or minutes to come up with a conclusion about certain questions in mind in this critically ill patients in this critical time in this critical situation and critical unit. So if you're gonna use your eyeballing, you have to adapt your eyes to see what's normal, and then to adapt your eye to seeing how is the abnormal is
You can
presenting
see if
like.
there is any masses inside the left ventricle, or you can focus on the mitral valve and so on. Again, in the apical views, you can do two modifications. Number one, you can direct your probe knob to be looking or mark to be looking at 1 o'clock or 11
Look
o'clock.
at it with me again. You cannot miss that this RV is equal, if not slightly bigger than the LV. So by definition, this is severe dilation of RV. If this is acute and matches with history that makes pulmonary embolism possible, this is very straightforward to diagnose pulmonary embolism. And you have to take care of patients in ICU under the effect of high PEEP or moderate PEEP.
Another question came to me about to explain more on the flattening of the septum and what does it mean that the RV is pressurized on systole versus diastole. A pressure on usually, normally, the right ventricle and the diastolic pressure is much smaller than the LV and diastolic pressure.
Tonight, we're going to entail to cover uh, two important uh, topics in critical care echocardiography. First one, which is the daily question in ICU, prediction of fluid responsiveness. How can we make this prediction by echo? How can we make it simple as we can? More beneficial and more reliable. So they use the thermodilution techniques for hemodynamics so they can see arterial waves, cardiac index, stroke volume variation, pulse pressure variation, extravascular lung water. These are all very nice numbers, but at the end of the day, they are numbers. Sometimes they mislead you because sometimes they are not concordant with what you see as per history examination, and the actual echo examination doesn't match these numbers sometimes.